So the research that I do is broadly classed as epidemiology, so understanding the prevalence and incidence of disease, and I focus on children's mental health. People's social circumstances are a massive determinant of their health throughout their life. So I became interested in understanding that better and trying to inform policy that can make health more equitable. Having worked in a hospital, you get to understand how the hospital system works, how the data collection works, and how different those two things can be from each other. So what you might see in an administrative record or a diagnostic code doesn't necessarily relate to what's actually happening in the ward, how that person is experiencing their health. It's really important that we start producing the information that can inform the policies that make population health more fair. So our project at the moment is looking at mental health disorder among children who've been on the Child Protection Register. So the Child Protection Register is a list of children within a local area who have had some kind of intervention with a social worker because they're at risk of significant harm. So obviously childhood experiences can have a really big impact on your mental health. What we did was link Child Protection Register, which is held by Aberdeen City Council, with health records held by NHS Grampian. And that's the first time that type of linkage has been done in the UK to explore kind of long-term health outcomes. And we found that all of the age groups and in all of the male-female categories that we could look at, the rates of prescribing and referral were higher for children on the Child Protection Register. And that ranges between 1.5 times to about 5 times the rate for the general population. So quite significant increase for those children in terms of risk of having a mental health disorder.